Welcome everybody, my name is Dr. Geoff Abrams from Abrams Acupressure and Chiropractic, and today I'm going to talk to you about how to relieve a headache through doing some trigger point work and acupressure work. So basically what you have here is the spine, and you can see these 101 Dalmatians that look red and blue, these little dots that you see here, and that's where muscles attach into the spine. And we know, as far as specializing in chiropractic, that the body works off the nervous system. So whenever you have a vertebrae that slips out of place, it'll put pressure on those nerves, triggering a headache. So having said that, muscles attach into these bones, and when those bones go out of place, those muscles get out of balance and they get those knots. Have you ever had your husband or say to your husband, honey, could you please rub my neck or rub my shoulders? And they dreadfully come over and they try to rub out those knots. Well, those knots are what we call in chiropractic trigger points. Okay? And what a trigger point is basically a pocket of toxins that build up in the muscle fibers, and basically the way you're going to work it out is through manual compression. So I'm going to illustrate how to relieve a headache on Rachel right now using my hands in acupressure technique. So if you would, Kyle, let's go on ahead and focus on Rachel's neck. So the first thing you want to do is you want to get a little bit of lotion. You put that on your hands, and then you want to rub it into your hands just a little bit to warm it up so you don't shock your patient out of the system. And then you're going to put it right here on her neck. Now where I'm going to focus especially on her neck is mostly in the upper cervical area, right underneath this bone called the occipital bone. So I'm going to turn her head gently here, and I'm going to take my thumb, and I'm going to go right underneath her ear, right along the ledge and the edge of the occipital bone. And you'll feel it because it's a real hard bone. And then you're going to rub it all the way down and in close to the center of the spine. And then when you find that hard end, feel that real big knot, you just want to bore in and put some pressure there. And you need to hold that pressure for about 30 seconds to about a minute. And then when that is ended, you're going to slide it down the spine towards her shoulders, as you can see as illustrated here. Now you never want to go ahead and go into this area, which is right at the top of the sternocleidomastoid muscle or the jugular veins, because you can actually have the person get unconscious and knocked out, and that's not the design here. So a way to avoid that is to have the patient lift their head when it's turned, and you can clearly see the muscle here, and so you're just going to work the edge of the base of this muscle. And then you just work it down, just like I'm doing right here. Okay? Alright, so that's it, and you're going to do both sides, and you can do that for about 5 or 10 minutes. I guarantee you it will help your marriage tremendously, and it will help that person who has a headache. So if you have any questions, please don't hesitate to call. My name is Dr. Geoff Abrams of Abrams Chiropractic here in Greer, South Carolina. Thanks so much for watching.